Hi everyone, I want to talk about neuroblastoma. Neuroblastoma. Neuroblastoma is a tumor from embryonic sympathetic ganglion cells. For example, it could be paragangliomas or Pheochromocytoma. I will make a separate presentation on Pheochromocytomas. It can secrete catecholamines, for example, epinephrine, norepinephrine, and dopamine. It causes fight or flight response, and with that, you're going to have increased heart rates, increased blood pressure, and increased blood glucose. It is also associated with central hypoventilation, Hirschsprung's disease, and neuro-fibromatosis type 1. Neuroblastoma can arise anywhere along the sympathetic nervous system, such as adrenal gland most of the time. And when we're talking about pheochromocytoma later on, I will talk more about that. There's possibility of abdominal mass secondary to adrenal gland enlargement, thoracic ganglion, cervical ganglion, and pelvic sympathetic ganglion. It can metastasize to the lymph nodes, to the bone marrow, cortical bone, dura, orbits, liver, the skin, the lungs, and central nervous system. The clinical features will involve secretory diarrhea, fever, weight loss, bone pain, anemia, hypertension, nasal obstruction, vasoactive intestinal polypeptide, bladder dysfunction, scoliosis, nodules. Also, there's possibility of abdominal mass, like I've explained, when it's from adrenal gland, pheochromocytoma, possible pain, constipation, when the orbits are affected, proptosis, meiosis, or ptosis, anhidrosis, back pain, spinal cord compression, and weakness. The differential diagnosis here could be Wilms tumor. I have made a separate presentation on Wilms tumor. Please kindly check that out. Could be hepatoblastoma, lymphoma, germ cell tumor, infection, osteosarcoma, mesenchymal chondrosarcoma, Ewing sarcoma, rhabdomyosarcoma, or leukemia. There's opsoclonus myoclonus syndrome. In that case, it could be as a result of tumors like hepatoblastoma or infections. Infections like poliovirus, parainfluenza virus, Coxsackie B3 and B2, Epstein-Barr virus, Lyme disease, Salmonella, syphilis, or HIV. Or could be as a result of injections of lithium, phenytoin, amitriptyline, diazepam, or cocaine, and might be secondary to toxic exposures like organophosphate. The diagnosis could be made having your complete blood count done, check the electrolytes, liver function test, renal function test, and vanillin mandelic acid, serum, and urine. Also check for homovanillic acid, serum, and urine because of catecholamines. Ferritin, LDH, can biopsy, do your CT, MRI, and 1 to 3 MIBG scan. Bone marrow aspirate, and biopsy. When you want to screen for neuroblastoma, pheochromocytomas myoclonus, which is a form of paraneoplastic syndrome in 2% of children with neuroblastoma, is as a result of autoimmune conditions. It will be rapidly forming, and the clinical features is a form of rhythmic jerking. That is, rhythmic jerking or myoclonus of the limbs and trunk, and the gait will be atasic. You can use ultrasound at 3rd trimester to pick the condition. Check the urine catecholamines at birth. Urine catecholamines at birth, because you are screening for neuroblastoma. The ultrasound can help at 3rd trimester. I've told you what pheochromocytomas myoclonus is all about in 2% of children with neuroblastoma. If there's positive family history of neuroblastoma, then you have to screen with complete family history, physical examination, radiological, and laboratory investigations. You can check for the evidence of metastasis to the bone with help of 123 MIBG, meta-LG-Benz guanine scan. And you can do bone marrow aspirate and biopsy at the iliac crest bilaterally. How do we treat? It could be surgery alone, or with chemo or radiotherapy. You are going to observe only if this is newborn, or if there is small adrenal mass, or there is localized neuroblastoma, or it is even a stage 4S disease, but it is asymptomatic. So why bothering the affected child? Chemo that you can choose from are cyclophosphamide, carboplatin, cisplatin, etoposide, teniposide, doxorubicin, or vincristine. And for induction purpose, you can have intensive chemotherapy. You use platinum agents, can use cyclophosphamide, doxorubicin, etoposide, or teniposide for induction. For consolidation, you use more chemotherapy at high dosage and use what we call autologous hematopoietic stem cell. And for maintenance, you can use cis-retinoic acid and immunotherapy, that is denosumab with cytokines. What are the possible complications? You are likely going to be dealing with tumor lysis syndrome. I have made a separate presentation on tumor lysis syndrome. Kindly check that out. You may be dealing with spinal cord compression. And when that is the case, that is an oncological emergency. When there is pheochromocytomas myoclonus, there will be cognitive impairment, motor delays, language deficit, and behavioral anomalies. And when you are dealing with pheochromocytomas myoclonus with all these features, treat with corticosteroids, intravenous immunoglobulin, or immunotherapy, rituximab is welcome. Prognosis is better if it is less than 1 year. That is good. If there's low risk of tumors like stages 1 or 2 only, that is great. If there's favorable biological factors, that is fine. Even if it has bad stage like 4S, but it is asymptomatic, that is good news. If there's no metastasis and there's no hepatomegaly, that is nice. If it is primarily affecting the thoracic region, then that's a good news. Still on prognosis, it's bad if the affected child is presenting greater than 1 year or is even a child that is older. That's bad. If the tumor staging is revealing stages 3, 4 to 5, that is bad. If there are unfavorable biological factors or symptomatic 4S stage with metastasis or hepatomegaly, that's bad. If there is primary adrenal tumor or with recurrent disease, that is bad. How do we treat? Just refer to pediatric oncologists. And with that, I've come to the end of this presentation. Kindly subscribe to my channel so that you can get these presentations immediately they are published. Thank you.